Let's take a look at how the usage of AI will transform the healthcare space. My colleague Sumita Karir visited Wipro's Remote Diagnostics demo, which demonstrates how the AI is helping in scanning and diagnosing the patients. She also caught up with the CTO of Wipro, Sandhya Ramachandra, to understand the scope of this technology. Let's take a look.
How will AI change the healthcare sector? Well, right here you have a glimpse of that. In fact, this is just a demo of how healthcare industry is going to be transformed and changed with the onset of AI. In fact, this is essentially a demo of a scanner which is being done by a doctor who is sitting remotely. The doctor is not in the vicinity of the patient. In fact, what we can see here is an AI arm or a robotic arm which is diagnosing the patient, and in fact after the diagnosis is done, the report of this diagnosis will essentially be sent to the doctor who is not in the same physical place. He is not in proximity of a patient. So this is just reflective of how operations of the future, how surgeries of the future, how diagnoses of the future are going to be done. This is going to be great, especially for places, for geographies which are not very well connected with urban centers. Ms. Sandhya Ramachandran from Wipro Technologies, who's going to take us through this entire process and how this happens here. I just wanted to understand, once the diagnosis is done, once the reports are sent, can you explain the process thereafter?
Yeah, sure. If you think about it, the Wipro Intelligence Health AI solution works towards making the diagnosis from the reports easier as well. So it is not just using AI for scanning, but it is using the information from scanning, producing reports, and making sure that the information in the report is interpreted and a diagnosis is undertaken and proposed to a senior doctor.
Okay. All right. And what about this overall ultrasound scan here? This is sent to the patient after the scan comes back?
This is visible to a doctor in real time, and the AI has produced these summaries, findings, recommendations, and rationale for the recommendations. The doctor can then view the screen and agree with the AI, or if he wants further investigation, he can recommend further investigation at the remote location. And then the care cycle
are remote surgeries? But are remote surgeries possible? This is essentially diagnosis via
remote diagnostics, and this is where there is a maximum congestion, right? As far as remote surgeries are concerned, that is a step after diagnosis and recommendation, right? So this focuses more on the care gap and prevention, whereas the surgery is actually a follow-up action after it. Today, if you see, there is a lot of robotic surgery that happens. There is a little bit of AI embedded in it as well, but it is still an evolving space in terms of all of us being confident enough to allow for remote surgeries. That's about it.
All right, so that's coming in from the India Impact Summit. We'll keep getting you more from there, but for now, it's curtains done on this edition of the newsroom. I'll take your leave. Thank you so much for tuning in.